local hospitals are still battling against this pandemic. We have Dr. Mark Wakefield live with us this morning from MU Healthcare to talk about how they're dealing with challenges during this public health crisis. Dr. Wakefield, thank you so much for joining us this morning.
Thank you and good morning.
Good morning. Now, before we talk about reopening, which I think a lot of people are excited to talk about, I wanted to ask about the current situation at MU Healthcare when it comes to new cases and ICU availability.
So at MU Healthcare, we've had no new cases identified, and we've had a steady rate of admissions. We've had 3 patients in the ICU, and that's been steady over the last week or so. And I think we're well prepared with ventilators available if we need them. So, I mean, we've done a good job of maintaining our capacity for any potential influx of patients.
And so that statewide stay-at-home order will be lifted Monday. So you talk about another potential surge of patients. Are you guys prepared for a possible secondary surge when that order is lifted?
Yes, we are prepared, and I think that we're uncertain of whether there's going to be a surge or not related to relief and increased social activity of people as businesses start opening up. Maybe we've given enough time, but I think we'll be prepared and anticipate a possible increase in number of patients that we have to take care of.
Okay. And so what do you tell patients who might be concerned about maybe coming to a clinic for a doctor's appointment as you are starting to allow more people to come into your facilities?
Right. So what I would tell them is, first, if we can do a visit by telehealth, that's a great option. But if you need testing or an examination for us to take care of you, then we'll do everything we possibly can at MU Healthcare to make it safe.
And I believe we have some video to go along with this next question for you, but MU Healthcare has put in some new measures that are going to keep people safe and keep your visitors safe when they come into your clinics and hospitals. What are those measures?
So 3 of the things that we're doing as an example are calling the patients the day ahead of time to make sure they don't have any symptoms, that they understand the procedures. Second, we're going to check them as they enter the clinic for fever or any development of symptoms. And finally, we're going to maintain social distancing. We're going to we have put up plexiglass between the PSR, that's the patient service representative, the person who's the receptionist, and the patient, and maintain 6 feet of space whenever possible.
Do you think that's going to become a new normal that we see in hospitals for quite some time?
I think so. I think just like the grocery store, we're going to adapt, and we're going to have a new normal where we maintain these social distancing and other maneuvers to lower the risk of community spread of the virus and a contribution to an increased number of potential cases.
All right. Dr. Wakefield, thank you so much. We always appreciate your time. We're joined now live by Dr. Mark Wakefield this morning from MU Healthcare to talk about how they're dealing with challenges during this public health crisis. Dr. Wakefield, thank you so much for joining us this morning.
Good morning. Thank you.
Good morning. Now, I wanted to jump back in again to talk about that current situation at MU Healthcare. We're kind of seeing a decline in new cases because we're talking about reopening. So how are cases right now at MU Healthcare?
So we're seeing the same experience that you described with the county and the surrounding counties, that we're not having any new cases diagnosed by and large, and a steady number of patients in the hospital. We do know that some patients who get admitted to the hospital are very sick, and they'll be here for several weeks. And so we anticipate that we'll have patients in the intensive care unit for several more weeks while they're recovering.
Okay. And we've talked about, starting to reopen. The state's looking to reopen beginning Monday, of course, in phases. What phases is MU Healthcare taking to reopen?
So we're starting to increase our capacity to take care of patients in person. So in the clinics, for example, we are putting safety measures to protect the patients and allow us to see more patients in person who need a physical examination or lab test or x-rays to be done to help guide their care. And in other areas, for example, we're going to start doing scheduled surgeries that have been deferred to allow patients to get the treatment that they need to move on from their medical conditions and improve after surgery, for example.
Okay, I was going to ask about those elective procedures because that's kind of the first thing we saw put on the back burner per se as soon as this virus started picking up. So what types of procedures will you start doing first?
So MU Healthcare had something more than 2,000 scheduled surgeries that were deferred, and then we tackled those surgeries that it was not safe to defer for the patient's well-being. So we have quite a bit of backlog of cases that need to be taken care of, and some examples would be someone who has a hernia, which is not causing symptoms that are severe right now, but has a risk of complications if not treated surgically. If we can safely manage that, then repairing that hernia in the near future is desirable for the patient.
Do you see MU Healthcare getting those procedures done quickly, or is it still going to kind of be a slow process where people might have to be put on a wait list?
I like the governor's analogy of this is not a switch. We just can't turn back on this capacity. So it's going to be a dial-up. And that's especially important to preserve the safety of the patients and the providers. And so I think it's going to be a gradual ramp up, and then if we can prove that we're doing that safely, add continuously more capacity, and then there'll be a phase where we'll have to probably work extra hard to catch up so that these patients don't suffer consequences of deferring their scheduled surgeries or other health care.
Okay, Dr. Wakefield, thank you so much. How long will you continue that no visitor policy at your clinics and your hospitals?
So we're continuously reevaluating our no visitor policy, and it's an important aspect of protecting our patients and not contributing to community spread. We know it's very important for our patients to have visitors. Personally, I've